Thank you for joining me. This is Dr. Gonzalez Torres in Life Sales through Facebook Live. Today we're going to talk a little bit about depression. I've decided to touch on this topic today basically because with the increase of COVID-19 and things that are occurring around us, depression is increasing significantly in society right now. I wanted to talk to you a little bit about symptoms of depression and what it looks like because I want you to have the correct information, and I don't want anybody out there to give you the wrong information about depression. So when we're talking about depression, I want people to understand it doesn't matter what type of religion you're in. It doesn't matter what you believe in. The truth is that all of us suffer from depression from time to time. Symptoms of sadness and things like that is that we struggle with, right? If someone goes to a particular church and in their church they're telling them that depression does not exist and that depression has to do with other forces in the air and whatever, I want you to let the person know. I want you to remember that Job went through depression when he lost everything and he asked God that if he could be dead. Elijah also went through a moment of depression or bout of depression in the time that he hid in the cave. So I want you to be able to respond to people when they're telling you that depression is not a significant thing and that it does not affect people who are Christian. And the reason I want to reiterate this and say this is because I've been asked the questions by Christian if having depression or anxiety is a sin. And I want to clarify to you that it is not a sin. It is a symptom based on the circumstances that you are living in your life, and that it is treatable and that you can work towards getting better. Okay? So have that clear. When somebody talks to you about depression and tries to tell you that it is not real, I want you to remind them about Elijah, and I want you to remind them about Job in the Bible. Okay? Those are the two easiest ones to remember. There's many of them, but those are the two easiest ones that I want you to remember. So going straight into depression. For us to determine that a person has a clinical depression or a situational depression, there's different types of depression or a mood disorder. We're going to look at that the person is struggling with these disorders for more than 2 weeks. They have to have the symptoms that I'm going to be displaying and talking to you today for us to even determine that it is depression. So, the person must have for at least 2 weeks, and these symptoms must cause significant distress or they might be bothersome. If they don't bother you, you're not going to look for help. So I already know that by you looking for help and coming to my office or calling me, it's because the symptoms are bothering you. So depression, you would have a depressed mood or feeling sad, feeling down, feeling that you don't want to do anything. Those are symptoms of depression. Having sleeping difficulties, trying to go to sleep and not being able to, waking up at night when you go to sleep, waking up to go to the bathroom and then just tossing and turning in bed. Those are all symptoms of depression. Loss of interest of pleasure in the things that you used to enjoy. You used to love to go to the park. You used to love to exercise. You used to love and sit in CTV with your spouse and your family. But all of a sudden, none of that is interesting, and it's easier for you to just lock yourself away and not deal with other people. Fatigue or feeling tired almost every day is also a symptom of depression. Significant weight change. Some people, when they're going through depression, what they'll do is that they'll eat too much and other people will stop eating. Those are symptoms of depression. If you find yourself in bouts of moments in life when you're eating, and you're feeling worthless and you're feeling sad and trouble sleeping, trouble concentrating, those are all symptoms of depression. Feelings of worthlessness, having low self-esteem is also a symptom of depression. Feeling that you're not worth it, feeling that nobody loves you, feeling that nobody around you is going to want to be with you. That does cause depression. Another significant symptom is a diminished concentration. Like I said, trying to see TV or doing things that you would read a book, but you just can't concentrate. There's so many thoughts, and sometimes it's just like a vague mind there that doesn't allow you to concentrate in those things that you have believed are important for you. Recurring thoughts of death. And this does not mean that you are going to commit suicide. What this means is that some people will start thinking about saying, oh my God, I wish I wasn't here because I don't want to deal with this situation. I wish I was just not having to be around people. I wish I wasn't having to do any of this. When a person starts having those feelings, those are indicative that they are going through a very tough period in time, and mostly it has to do with depression. If you are having a crisis or an emergency where you do have thoughts and plans to hurt yourself, please call 911 or call the National Suicide Hotline. Their phone number is 1-800-273-8255. 1-800-273-8255. If you are struggling with symptoms of suicide, wanting to hurt yourself, then it's important for you to call this number and get connected with a counselor as soon as possible. Depression is not worth you losing your life. Depression is something that can be treatable, and because it is treatable, we recommend that you get the help that you need. Doesn't matter if it's with me, it's with another therapist or another counselor, but it's important for you to get treated. So what are the demographics? Who are those people at risk to have depression? Women, unfortunately, are more likely to have depression. However, depression could occur at any age, from young age all the way to 99. Like I always say, I treat people from 0 to 99. Depression is more likely in women because of the change of hormones that they go through. They have a menstrual cycle every month, and there's a lot of hormones involved with that. They have children, there's a lot of hormones involved with that. When their menstrual cycle goes away, there's a lot of hormones involved with that. So the female reaches or does their body is completely different than from a man, even though a man does have andropausia, and when they're and I don't know how to say it specifically in English, but it's called andropausia. And when a man's changes come, just like the menopause, they start having symptoms and bouts of depression. Some of them get a little younger when that comes, right? They start changing the way they do things. So those are some of the demographics. About 1 in 10 people struggle with depression. About 5 in 10 people have a mental illness. So if there's 10 people in a waiting room or 10 people in a church, one of those people in there is going to have depression. And if there's 5, one of them is going to have a mental illness. Most people experience depression at ages 20 or 30s. But however, like I said, it could occur at any age, from childhood all the way to elderly age. What are the risks for depression? Having a family history of depression. If there's anybody else in your family that has struggled with any mood disorder, which could be depression, bipolar disorder, cyclothymia, there are so many, premenstrual dysmorphic disorder. Any of the disorders that are related to the mood can cause depression, or you can have the genes of depression, basically is what it means. So those are things that I want you to kind of look at. If you have depression, it is more than likely that you may also have symptoms of anxiety. And we'll talk about those in another day, very specific like I'm doing here, a very short condensed version of what these symptoms are. This is part of what I do in therapy. Obviously, I'd explain much more in therapy and talk a little bit much more. But today in our women's group, I wanted to give you a condensed version of what I do in a therapy session. What are other risks for depression? You have poverty, a person that is struggling with poverty. A lot of people today are struggling with poverty. A lot of people have lost their jobs. And all of those events can cause symptoms of depression in a person's life. Social isolation and other stressful life events. So why is it important during COVID-19 to talk about the symptoms of depression? Because if you've noticed, some of the risk factors for it is social isolation, is losing their jobs, is going through stressful life events. And all of these things are occurring now. Kind of people are at the phase where they were at first very, very anxious because they didn't know what was going on, and people were kind of going and moving through the speeds of what's going on. But now in this after phase where it's been more than 8 weeks, well, it's been 8 weeks in which we've been isolated. symptoms of depression are going to start setting in for a lot of people. So I wanted to educate based on it because I want you to identify those symptoms, and I want you to call if you are having these symptoms. Call. It doesn't have to be Maria because you're in this group, and I'm actually going to share this video live on YouTube and on other areas because I want people to be educated. So please, if you're having symptoms of depression, call a local counselor. Find them. You could just write counselor on your phone. You could go to apps like Psychology Today, and you can write your zip code, and it'll tell you the counselors that are around in your zip code. Some of us that are in Florida, I can serve all Florida because I have a license for the state of Florida, and I do telehealth. So it doesn't matter where you live, you can have services with me if you're in Florida. Through the state of Florida. Obviously, as being a doctor in behavioral health, I can serve people all over the country. Regular drug and alcohol use is also a very important factor that can increase depression. What a lot of people don't know is that they find themselves in a cycle of alcohol because they feel that alcohol numbs their symptoms. But the truth is, when alcohol is starting to decrease in your system and you start feeling bad because of the alcohol that you just had, if it was a whole bunch of alcohol, and you're having this hangover, like people would say, then you don't want to feel it. So because you don't want to feel it, again, you start drinking again and get yourself into that numbing area where you don't have to feel, don't have to think about everything that you've suffered and everything that you've gone through. So what happens is that, again, you keep going through this cycle, these up and downs, and you keep using alcohol to a point where it becomes addictive and you can't release it. So same thing goes with drugs. Drugs are used to numb, to forget, to not think about the things, to chill. Obviously, marijuana is also used a lot for symptoms like this, but it's mostly used for anxiety. What I recommend to my patients that do use marijuana, one, if you could abstain from it, abstain. If you cannot get it through a certified doctor, go to a doctor and get it if that's what you need. But do not find yourself driving your car with some marijuana if you do not have a certification to use it, because you're going to be charged. So you want to do things correctly. If this is something that you prefer to use, I don't condemn it. What I try to ask you to abstain from it, because in long term, it's been shown marijuana use as you buy it in the streets and stuff like that, it's been shown long term to cause memory loss earlier for our elderly. So that's why I don't really recommend it. But if you need it, I'm not going to fault you for that. I'm going to say go to a certified provider that can give it to you. And you can have a card saying the reason why you need it. We don't want you to be stopped by the cops because you're using something that you feel you need. How do I treat anxiety or depression, which is what we're talking about today? The best treatment modality that has been shown is cognitive behavioral therapy. It's been proven through the years, and the reason for that is because it helps think about self-defeating thoughts that we're having when we're having symptoms of depression. And medication. Medication is also used, but it's not always required. Sometimes you can go to 5 or 6 sessions of psychotherapy, and once you go to those sessions, you don't need medication. Some people do need medication because they have a serotonin imbalance or other things like that. So that's important for you to know that those things do occur. You may need medication, but you may not. So first go to a therapist. If you go to a primary care provider, the optimal primary care provider is going to refer you to therapy before giving you medication, because therapy can actually help you when you're in need of healing from depression. So that was our talk for today. And like I said, I'll be sharing this video out live on YouTube and other areas because I want people to be educated on depression. Blessings to you. This was Dr. Gonzalez Torres and Life Sales through Facebook. Bye-bye.